because it comes from a plant, it must be safe, right? That sounds reasonable. After all, we eat plants. We drink herbal teas. We use plants in traditional medicine. But essential oils are different. An essential oil is not simply a plant in liquid form. It is an extremely concentrated mixture of chemicals extracted from the plant. And some of those chemicals can irritate your skin, trigger allergic reactions, cause severe burns, or become dangerously toxic when swallowed. Some can even become more irritating as they oxidize during storage. And that creates an uncomfortable question. What happens when something that is biologically active is marketed as if it were just a pleasant, natural fragrance? That is the dark side of essential oils. Let's start with something important. This video is not about saying that essential oils are useless. There is evidence that aromatherapy can provide modest, short-term relief for things like anxiety, sleep problems, pain, and nausea. Lavender, peppermint, ginger, and some other oils have shown benefits in certain clinical settings. But the evidence is mixed, and there is a big difference between saying, "This may help you feel better for a while," and saying, "This treats the underlying disease." The evidence is much stronger for the first claim than the second. So the question isn't simply, do essential oils work? The better question is, which oil? At what concentration? Used how? For how long? And for whom? Because the same chemical properties that may produce a useful biological effect can also produce an unwanted one. And that brings us to the first problem. Plants are not chemically passive. They produce thousands of compounds to survive. Some help attract pollinators. Some protect the plant from microbes. And some discourage insects and animals from eating them. Essential oils concentrate many of these compounds into a very small amount of liquid. You may have heard names like limonene, linalool, menthol, eucalyptol, methyl salicylate, or terpenin 4-OL. These aren't just natural smells. They are chemicals with biological effects, and your body responds to them. Sometimes that response is useful. Sometimes it isn't. One of the clearest examples is the skin. Undiluted essential oils can cause irritation, burning, redness, or even chemical injury. But there is another problem that is less obvious. Repeated exposure can sensitize the immune system. In other words, you might use an oil several times without a problem, and then suddenly develop an allergic reaction to it. After sensitization occurs, even a relatively small exposure can trigger dermatitis. And some oils have another special hazard: phototoxicity. Certain citrus oils contain compounds called furocoumarins. When these compounds are on the skin, and the skin is subsequently exposed to ultraviolet light, they can produce a reaction called phytophotodermatitis. The result can be painful redness, blistering, burns, and dark pigmentation that may last for weeks or even months. So, natural doesn't mean chemically inactive. In fact, the chemistry is precisely why these oils can have effects in the first place. Now let's talk about something much more serious: ingestion. Essential oils are highly concentrated, and swallowing them is not equivalent to drinking herbal tea made from the same plant. A few drops of an oil can contain a surprisingly large amount of concentrated plant chemicals. Some oils can cause central nervous system depression. Others can cause seizures. Some can injure the liver. And aspiration into the lungs can create another serious problem. Children are particularly vulnerable because even a relatively small quantity can represent a significant dose for their body weight. Eucalyptus oil is one example. Camphor is another. And wintergreen oil deserves special attention because it contains methyl salicylate, a compound related to aspirin. Concentrated wintergreen oil can be extremely dangerous when swallowed. This is why those little bottles sitting on a bathroom shelf aren't as harmless as they look. A child doesn't need to drink the whole bottle. A small amount can potentially cause serious poisoning. And this is also where drug interactions become important. Some essential oil compounds can have pharmacological effects, and some oils or their constituents can interact with medications. So if you're taking medication, pregnant, caring for a young child, or dealing with liver or kidney problems, it's natural is not a sufficient safety assessment. This brings us to one of the most complicated questions. What happens when you diffuse essential oils into the air? The answer is more nuanced than either extreme. Inhalation is generally associated with much lower acute toxicity than swallowing concentrated oils. And, in fact, inhalation is where some of the better evidence for aromatherapy benefits exists. But lower risk does not mean zero risk. Diffusers release volatile organic compounds into indoor air. For some people, especially those with sensitive airways, strong fragrances can cause coughing, throat irritation, headaches, or breathing discomfort. People with asthma may be particularly sensitive to fragrances. And there are still unanswered questions about heavy, prolonged exposure to concentrated fragrances indoors. So I would not tell you, never use a diffuser. But I also wouldn't tell you, because you're only breathing it, there is no possible downside. The evidence simply doesn't support that level of certainty. And there is another group we need to talk about. Pets. Dogs and cats process many chemicals differently from humans. Some essential oil compounds can be particularly problematic for animals, especially when oils are ingested or applied directly to their skin. Tea tree, peppermint, citrus, cinnamon, pine, and several other oils deserve particular caution around pets. Cats are especially vulnerable to certain compounds because of differences in their ability to metabolize them. So don't assume that an oil that seems harmless to you is automatically harmless to your cat or dog. And never apply an essential oil directly to a pet unless your veterinarian specifically recommends that product and method. Your diffuser may smell wonderful to you. That doesn't necessarily mean your pet is having the same experience. Now we get to another part of the story. The bottle. You might see words like pure, natural, therapeutic grade, organic, detoxifying, immune boosting. But these words can create a powerful psychological effect. They make us associate the product with safety and health. And that's where the naturalistic fallacy enters the picture. If something is natural, it must be healthier. But nature doesn't work that way. Arsenic is natural. Poison ivy is natural. Botulinum toxin is natural. And some of the most powerful medicines we have originally came from plants. The fact that something is natural tells us where it came from. It does not tell us whether it is safe. There is also a practical issue that doesn't get enough attention. Essential oils are chemically complex products. Their composition can vary depending on the plant species, growing conditions, extraction method, storage, and age of the product. And oxidation matters. Compounds such as limonene and linalool can change chemically when exposed to oxygen and light. Some of those oxidation products can actually be more allergenic than the original compounds. So that bottle sitting in a warm bathroom for several years isn't necessarily chemically identical to the freshly produced oil you started with. And product authenticity is another concern. Commercial products can vary in purity and composition. Some may be diluted. Some may contain additional ingredients. And adulteration or substitution can make it difficult to know exactly what you're putting on your skin or breathing into your home. This is one reason laboratory testing and standardized chemical characterization matter. The label alone doesn't tell you the entire chemical story. So should you throw away every essential oil in your house? No, that would go beyond the evidence. A more reasonable approach is to respect them for what they actually are. Concentrated chemical products with potential benefits. And potential risks. If you're using them topically, don't assume that more is better. Dilution matters. A commonly used approach for general adult topical aromatherapy is roughly 1 to 2% essential oil in a carrier oil, although the appropriate concentration depends on the specific oil, the purpose, and the person using it. Some oils require much greater caution, and children require substantially more conservative approaches. If you're trying a topical product for the first time, consider testing a small area first. Stop if you develop burning, redness, itching, or a rash. Be particularly careful with citrus oils and sunlight. If an oil is known to be phototoxic, don't put it on exposed skin before ultraviolet exposure. And don't casually ingest essential oils. Especially not because someone on social media told you that a few drops in water will detox your body. Water does not make a concentrated essential oil safe to swallow. Keep bottles securely away from children. And remember your pets. If you're using a diffuser, Provide ventilation and don't assume that continuous diffusion is better than occasional use. If someone in the household develops coughing, headaches, breathing difficulty, or other symptoms after exposure, stop using the product and see whether the symptoms improve. And there is one final distinction I think is important. Essential oils don't have to be miracle cures to be useful. They may help you relax. They may make a room smell pleasant. Lavender aromatherapy may help some people sleep. Peppermint may help with nausea. And certain forms of aromatherapy may provide short-term relief from anxiety or discomfort. Those are reasonable claims. But when the claim becomes, essential oils cure infections, essential oils treat cancer, essential oils can replace your medication, that's a completely different level of evidence. And that is where wellness marketing can become dangerous. Because delaying effective medical treatment while relying on an unproven remedy isn't harmless. So when you see the words 100% natural, don't stop there. Ask, what chemicals are in it? How concentrated are they? How am I being exposed? And what does the evidence actually say? Because natural doesn't mean harmless, and concentrated doesn't mean better. Essential oils can have a place in a healthy lifestyle, but the safest approach isn't fear. And it isn't blind trust. It's informed use. If you found this video useful, please like, subscribe, and join me for the next episode. Until then, stay happy and healthy.